Good morning, everyone. We're going to go ahead and get started.
Tommy didn't want to do it.
So good morning, everyone. I'm Veronica Jackson-Patrick with the Veterans Experience Office. I do hope that those of you who have dialed in are able to hear me and see me. We had a little bit of technical difficulties this morning, as you all know, which we have whenever you're dealing with computers. But we're rolling through them, and we thank you very much for participating today. So I am going to deviate just a little bit from the agenda because I know that we have our guest speaker on the phone, and I want to turn it over to her for special remarks. So by way of introductions, we have Dr. Linda Davis, who's the Chief Veteran Experience Officer, on the phone to give special remarks. Dr. Davis?
Good morning, everyone. Can I beg your indulgence to hold just one moment, please?
Yes, ma'am. Would you prefer that that Jim give the welcome remarks? So we are going to give Dr. Davis a few moments. I kind of sprung that on her. She was a little earlier than her speaking point. So before we begin, I'm just going to back up a little bit. Welcome you all to the Midwest Community Veteran Engagement Board networking event. This is actually the second of 5 national events that will take place, hosted by the Veteran Experience Office, to bring together community veteran engagement boards that are currently in the VA network, those community partners who are interested in either joining a board or starting a new board, and also just for community collaboration. So we thank you all for coming today. I have several individuals here with me in the room. We also have many individuals joining us via WebEx, some by phone. We have a Cisco telepresence facility in Wisconsin, and I know the Cleveland VA is also joining us. So thank you all for dialing in.
And I'm back now.
That's great. Thank you.
But not to interfere with your efforts.
No, that is totally fine, Dr. Davis. We know that you have several irons in the fire, so we want to maximize your time. So I'm going to give the floor to you to give the opening remarks.
Well, I hope you can hear me.
Yes, ma'am, we can.
Okay, great. First, thank you. I thank my Veteran Experience Office community engagement team for organizing these events and this particular one, and I really thank everybody on the call. As is my tradition, and because we're talking about the veteran experience, and I happen to be a veteran, and I happen to be caring for veterans, I'd like to just bring us down and start this effort with an example of why we're all together. And as I share this, it happens to be my personal lived experience at the moment, but it is not about me. It's indicative of what you all deal with in your communities every day. As you know, and we'll hear more about, the Veteran Experience Office has many, many different ways to approach our listening to the voice of the veteran, family, caregiver, and survivor. And those do include our surveys, and it includes the web, it includes social media, and it includes the engagement we get from reaching out with you in efforts like this. We call all of these ways in which, these multi-channel ways in which we listen for the purpose of program improvement and service recovery, we call these now our veterans signals. The way we make sure we're tuned in to what our veterans need so we can deliver the highest quality care and benefits services in the ways they need it, not only in our facilities or in our regional offices, but more importantly in the homes they live in and the communities that they live in with the support of folks like you. So I was just on the phone having to delay our call, my participation, because I'm currently taking care of a REA-era wheelchair-enabled disabled veteran who I need to go and hospitalize today. So I was talking to the doctor, the internist, and thank you for your patience. This particular person, my brother-in-law, can use the benefits of the VA for his health care. What he can't qualify, because you know the complexities of different veterans' ratings, is some of the other benefits, which include housing, which include sometimes aid and attendance, which also include things like respite for caregivers. So here I spend hours trying to case manage his support, that everything from addressing his spiritual needs to his clinical, medical, and psychiatric needs, and then his benefits. That engages the county, it engages the faith-based communities, it engages friends and family, and it's a web we have to create to have a comprehensive wellness plan for any person to be able to function. And some are more complex than others, and usually as we age, I just had a birthday yesterday, so I'm particularly sensitive to the aging part. Our needs change, and we need actually more. We know that none of this we could do alone at the VA. And so I just have to say how appreciative I am of all of you and the team that's working so hard to support you. This is, in fact, our second of 5 Community Veteran Engagement Board network events that our Veterans Experience Office is hosting. This gives us a chance to connect with local community members like yourselves, obviously the CVEBs. We invite our VA leaders locally from the health and benefits, Memorial Affairs, and if you haven't seen it, Memorial Affairs has a fabulous new YouTube video out that'll just break your heart. So great. We have state and county officials and our academic partners, which are so key as we do, research and training for our providers. So many nonprofits are on the call and leading this effort, and our private organizations. Many of our CVEBs have great private providers and industry and business, which we couldn't do without. Right now, as you all mainly know, we have 142 CVEBs in our network, and my goal is to get us to 200 as soon as we can. Some of the groups are very mature and have been there a long time. Others are new, all equally important, just at different stages. And this networking opportunity gives us a chance to come together and share experience and observations. We have over 30 of our CVEBs have already received our in-person appreciation through our veteran-friendly community initiative. And we'll be doing some more of those this summer, and we have leaders from the VA coming out to present a certificate acknowledging the excellent work that's done in a community. So please know that that's an option for you as your CVEB and your community engagement matures. For today, we're here really to listen and promote your interaction with one another so that you can have a stronger connection, a stronger coalition amongst yourselves. It's not to impart what we know, although it is to share information, and it's not to impart a one-size-fits-all, but it's to capitalize on what you're already doing, to brainstorm what you find is a local solution, to share the best practices and lessons learned. And I love hearing not only the challenges, but the success stories. And to create this kind of, you have local networks of resources. I please beg you to please make sure that those resources are also included in our national resource directory. That is just so very important. As I said, you are so key to supporting families like mine, and we're also taking care of a disabled World War II surviving widow. We can't do this with just the VA. We really, really need you. And I particularly appreciate the kind of coalescing leadership that is provided through some of our partners like the America's Warrior Partnership and the Bob Woodruff Foundation. They're just a few of those who are our strategic partners, but they're helping us with the collective impact efforts, and those are greatly appreciated. One of the things I want to share, and it may not be the time now, but I want you to know that the difference that you will begin to see over the next 6 months in the VA is our rollout of customer service in the context of the overall President's Management Agenda led by the Office of Management and Budget, which explicitly states that customer service is a requirement across all of government. It is also written in legislation such as the Mission Act that passed. Our VHA and our VBA, our health and benefits, will be required to report on their, quote, customer service. And for us at VA, being the first federal agency to really have a robust customer service, which we call our Veterans Experience, or Veterans Experience Service Office, we're going to be really very active champions for this effort, not only to spread further and deeper within VA, but across whole of government. And some of you have seen this already in the surveys that are taken now by veterans as they have their outpatient visits at our medical centers. Those will be enabled. We're testing now on a handheld device, so they'll be able to push in real time comments to us. We'll also be surveying inpatient services and moving to VBA very quickly. So we'll know what the veteran is saying in real time about his or her experience with any of our benefits and services, so we can improve those, not next month, but immediately. So as we go along, I know that Jim and the team can provide you with additional information, including handouts on those and links. That customer service is only one of the many efforts we're doing. Of course, we're trying to respond to the choice program. We have the expansion of the caregiver stipend that goes to the pre-9/11, which we're working on. We have an effort to try to get mental health care more quickly and comprehensive care more quickly to those who are catastrophically injured. We also have the Choose Home initiative, and some of you have participated in that, in which we're trying to ensure that veterans, such as my brother-in-law that I mentioned, have the option to choose at home, and family members are fully supported with all the, not only the VA, but the community-based services that they need to make that successful. There's a lot going on right now, but I want you to know that it comes out of our veterans experience and the community experience. And I'm very, very grateful for everything that you're doing we look forward to supporting you as a key anchor and partner in all of our customer service or veteran experience efforts. And I look forward to hearing the rest of your conversation as much as I can, and hearing the takeaways too and what you need from us. Thank you, Jim, Andy, everybody, and the team for putting this together.
Thank you, Dr. Davis. So I am going to give before we roll into the more formal portion of today's agenda, I'm going to give a few administrative notes, a couple points to note. If you've reviewed the agenda, you know that we have a jam-packed schedule, and we definitely want to maximize that time. But it was purposely divided into two portions, if you will. The first portion will be a series of presenters to provide information, and the information that the topics that were selected were based on feedback that I received from the Community Veteran Engagement Boards as far as the topics that they would like to hear more information about. So there's everything from women veterans to VA updates, also community collaboration and funding for CVEBs. How do you gain the resources needed to take care of veterans in your local community? So our hope is that you're able to take that information back to your local community and begin to put it into action. And then the second portion of today's event will be the open dialogue. I have a couple of co-chairs here from some of our community veteran engagement boards, and we want to hear from them as far as their best practices, what's going well, what are some challenges they've faced, and how did they overcome them. So we ask that you stay actively engaged, and thank you very much for staying flexible as we work through some of our technical issues. But keep in mind also that the discussions and some of the issues that are raised today will not be resolved today, and that's not the intention. The intention of today's forum is to provide a springboard for us to continue these discussions and to continue the activities with one another after we leave this room. So the work is actually going to start once we leave the room. The work will continue once we leave this room. So I do ask, for those of you who are joining us by WebEx, please remember to mute your lines. If you have a question for one of the presenters, please type it in the chat box. I will do my best to monitor questions, and I will ask the presenters because they won't or may not be able to see your questions during their presentation. But if for some reason your question is omitted, then do know that I will at least follow up with you at the conclusion of today's event to get responses, to get answers to your questions. So without further ado, I want to turn the floor over to Jim Wartke for your formal welcome. Jim Wartke is the Executive Director for Community Engagement with the Veterans Experience Office. Jim, are you with us? Jim, if you're speaking, you're muted.
Can you hear me now, Veronica?
Yes, I can hear you.
Oh,
Thank you.
That's good. I don't know whatever put me back on mute, but I don't know. But thank you, Veronica. You're doing a terrific job at opening up this networking session, and special thanks going out to Dr. Davis because she did a wonderful job at going through all the information that she put out, and I was just checking off. As Linda was talking, all the different things that I was going to say. So it's great to hear that a lot of it's been covered already, and I really appreciate what Dr. Davis has added as her opening remarks to be the catalyst to kick this one off. A couple of things that you have heard. This is the second of 5 events. The first event, I was physically present at the Cisco location in New York City, and this one we're going to try a little bit different, so I'm remote. And I'm remote to everyone from Florida, and it truly makes this a national event. So I think this is working great. We're going to give it a shot at seeing how these remote activities are working and coming together. Some of the other things that I wanted to discuss, too, in the opening remarks that I heard covers 142. 142 currently recognized community veteran engagement boards, with Dr. Davis putting the goal out there for us to ultimately reach 200. Which would be a beautiful footprint across the United States, and that would be the goal that we're going to be trying to do. One thing I do want to share with everyone and it's kind of comical, is always have a backup plan. So as I had a rehearsal of this at one location earlier in the week, and I had a very strong signal, I'm now at a different location in Florida, thinking that I'd be able to hop on with a strong signal, and unfortunately I was not. So I'm calling in, which is the backup plan, is that I'm calling in, but we do have a slide presentation to go forward. So naturally I go to my backup individual, who's my deputy, Chris Olson. And Chris Olson will be taking us through a slide presentation through Skype. One thing I will also admit or introduce is that Chris is calling in from Arizona, once again, to give the networking capability that even though we are a national, across the country event going on virtually, we're all in communications. I'm right now in Florida, and Chris will be briefing us from Arizona. And I'm sure we'll be talking to everyone across the United States. And for the other three that are going to be happening, the events have been published, and you're more than welcome to join in case you want to hear some additional comments or additional time to find out what we have to say with the Community Veteran Engagement Boards. It is a two-way street. And as Veronica so eloquently put, we'll be giving information out in the first part, but on the second part, we want to hear what the communities have. The VA wants to listen. And above all, I want to say thank you for allowing the VA to participate and partner in the communities. We appreciate and value that honor. So, Chris, let me hand it over to you as my deputy, and hopefully you can take us through on this this presentation, the slide presentation through Skype. So thank you very much, everyone. I hope this is a great next couple of hours of us communicating back and forth, learning information, and sharing, networking with each other. So, Chris, take it away from here, buddy.
Oh, wonderful. And thank you, Jim, for the introduction. Veronica, thank you for getting this set up and for your participation in this as well. Dr. Davis, if you're on the line, I also want to thank you for joining us today. It's very important to have your support with these efforts, and we all love to hear the insights coming from you. I also want to thank our CE field team spread out across the country for their work on this. Thank our strategic partners and our presenters, our community board members, and other community partners that have joined us today. These are exciting times, as you heard from Dr. Davis, as we continue to work together and grow this network of community support out there. You know, our collective impact efforts across the country are really growing, and this is outstanding, you know, support community-wide in support of our veterans, service members, caregivers, and survivors. So Dr. Davis did a very good overview of sharing a lot of the what we're currently working on, what we're doing, a lot of those projects. I want to take a few minutes just to kind of share a little bit about the structure of our office and kind of how we're doing this. So I've got a couple slides that we'll go through, and if you give me a minute, I will get those queued up. Okay. Okay, so I think we've got the slides showing now. So the Veterans Experience Office. You know, really to kind of sum it up, what are we trying to do? What are we trying to do with communities out there? We're focused on two main things. You know, collecting, analyzing, and sharing the experience of veterans, families, caregivers, and survivors with VA services. That's the voice of the veteran. That's, you know, what we're doing with our communities. We're out there, we're working with you, we're talking to you, we're hearing from you, we're hearing from our customers, and we're taking that information back, and we're making decisions based upon what we're hearing. And we're also working to inform VA policy and operations for accountability, service recovery, and program improvement. So again, we oversee 2 federal advisory committees that do provide direct recommendations to the Secretary in support of that. But we also are using all of the data and analytics and the lessons learned that we pick up from the communities and the things that we hear from our customer base to help us drive and inform policies that need need to be worked on, revised, in some cases updated. So, in 2015, our office was really, that's when we were created. That was the inception of our office. And we were really created to be the steward, the honest broker for VA to achieve its mission. We've been really working hard. We've been working hard to rebuild the trust of our customers, of our communities out there. And that has really set the tone for things moving forward and why we are, kind of on the leading edge of customer experience across government. And so we're positioned very well to move forward and be one of the best customer experience organizations in government. We've set ourselves up as an agile, entrepreneurial, and imaginative office, and we have an enterprise view across the administrations. And so that's been somewhat different. We work with our Veterans Health Administration, Veterans Benefits Administration, National Cemetery Administration, Board of Veterans Appeals. We work with everyone in all of our program offices and bring all of that together in all of the efforts that we're doing. We've worked with, our partners in the community, in business and industry, and we've learned the best practices in customer services, and we're bringing that to our organization. We use a human-centered design approach to, go out there and talk with our customers, our veterans, our veteran service organizations, our CVEBs, to understand the pain points and figure out where the unmet needs are of our veterans so that we can proactively work in those areas. And we've defined a common understanding of how we measure customer experience. And I'm not going to go into it in detail today, but we're really looking at the ease of working with the VA, the effectiveness of those interactions with VA, and what's that emotion that's attached to those interactions. And really, that's where we get into what was your experience like. There's an emotional component there that we're really trying to tap into. So, as I said, we were stood up in 2015. So over the last 3 years, what have we done? We've really continuously matured our model. We've refined our customer experience capabilities and the framework from which we're operating in to ensure that we are collecting that data and the insights from our customer base in the most effective manner possible. And we're incorporating those into our employees' day-to-day interactions with our customers. And so, again, you can see how this ties all right back into the work with the communities that we're doing. We're hearing from you, we're listening to you, and we're taking what we're hearing and listening to, and we're taking that back, and we're working on it, and we're trying to address those things that we see. So if we go to the next slide here, talk a little bit about the organizational structure. As you can see, Dr. Davis there, her picture. In our organizational chart, we are aligned directly with the Secretary's office. So Dr. Davis has a direct communication with the Secretary and the Deputy Secretary. We work with them to really be their insights engine of the administration and, really take guidance and direction from them, but we're able to really provide them that, real-time feedback of what's going on throughout the organization. Also, working with Dr. Davis in Washington, D.C., we have Barbara Morton. She's our Deputy Veterans Experience Officer, and you can see there Lee Becker. He is our Chief of Staff. So didn't pull an org chart up, but just to give you a little bit of context of how we're getting all of these projects and how we're working with the administration. VEO, as we call it, the Veterans Experience Office, we're organized into 6 different directorates. And the first one being portfolio management. And really, portfolio management, what that does for us, it's a coordination of all of our efforts. They do the new project intake, they take that, they evaluate that, and then they're helping to do the resource management for our organization. We have insight and analytics, and I mentioned human-centered design earlier. They are using those processes really to get out there and capture and analyze the voice of the veteran. So that's where we're getting that real-time feedback. And not only the voice of the veteran, but their families, caregivers, and survivors. We're doing a lot of work in those areas because they are all important customers of ours, and we have different needs to address each of these groups. Patient experience. What they're doing is they're out building and delivering veterans experience tools and data specific to VHA. So they're addressing the needs of VHA specifically. We have another directorate, Benefits Experience Directorate, and they're like PX, but they're channeling their focused efforts to work closer with the Veterans Benefits Administration, the National Cemetery Administration, and the Board of Veterans Appeals. And then we have multi-channel technology, so that's kind of just what it sounds like. That's the IT arm of the organization. So, and they are working on all of our communications channels. The most visible is the new website, vets.gov. They are working to build out a new vets.gov site for our customers so that, they really can go to one site that is well organized and find out more information and how to apply for, health care benefits and services with VA that they have earned. And so we're making a lot of progress in that area, and I think something that we're all pretty proud of because we've all had part of that. And then lastly is community engagement, and that's kind of where I sit today. And we're really working in support of our veterans through the coordination and integration of those local VA resources and the non-VA services at the community level. And so really we're kind of helping to facilitate, plugging these organizations into one another and helping facilitate the standing up of new boards across the country in our communities to ensure that the VA leaders have a seat at the table, and we have all those community partners, with a seat at the table as well. So we get people together and get them talking. So that's where we are today. So let's take a moment and let's talk about community engagement specifically. We have a team that's located, nationwide across the country. So we have people servicing the entire continental United States and our territories. So we have a local representative. What we're really trying to do is partner with you, the local communities out there, and in areas, specific to outreach, navigating services, brainstorming local solutions, and really enabling that two-way communication so that we are able to share from VA with the community, but we're also able to learn, and the community is able to share with us. And, the bigger picture there is the collective impact effort. Organizations within that ecosystem of where you are able to start, sharing with one another and learning from one another. And once we start bringing people together in this manner, we're really able to start serving the veteran community well. So why are we doing this? If you look at the challenge early on, what we identified was that, in some communities, our veterans, our families, our caregivers, our survivors don't have access to a coordinated support system. It can be very overwhelming for them to try to find the benefits and services and different options for healthcare out there available to them. It's very difficult to navigate the VA. And so what we really, have come to understand is we need to partner with the community and, in the community-based partnerships to help us bridge these gaps in services. And we've had a lot of success. So I want to thank you again for all being here and being a part of this effort. CVEBs. CVEBs are a perfect example of how we do this. We help facilitate in the community. We work with you, and support you. But what we really have done is we've brought the community together to a common ground. Everybody has a seat at the table, and we're able to take a look at the local community, the local needs, the local challenges, and we're able to work together on creative solutions that kind of help move those things forward and solve those problems. So who are we working with? We're working with, our key partners out there, community leaders, for sure, our VA leaders. We're in touch and we communicate with them regularly. The Department of Veterans Services, our directors, from Veterans Services at the state level, they have been a tremendous partner of us in helping us to work with you and work with the communities in their states. Veteran service organizations, military service organizations, and again, all of the nonprofits and others that are working in the veteran space in the community. We're working with all of you and trying to work together. And then we're also working to establish strategic partnerships. And those, are both, at the local level, but also at the national level, and both internal and external to VA. And, today's agenda is a perfect example of that. If you look at the agenda and who will be presenting and sharing some information today, we have the VA Center for Women's Health. We have the Board of Veterans Appeals that'll be here, but we also have the National Veterans Intermediary. They'll be speaking with you today, and we have American Warriors Partnership. And all of these are strategic partnerships that are helping us to, share information at the local level with our communities in an effort that we can all, work together and improve our collective impact efforts across the country. So, and one of the outcomes that we do respect and hope to continue is through these community efforts, we're able to, have that voice right into the community and share the VA priorities. So that has been a tremendous asset for us. We're able to share what's going on with VA, with the community directly, and it is that conduit of information. So things that we're hoping to achieve is a coordinated support system in your local community with you. We're really trying to be out there listening to our customers, really hear them, and then taking that information back and informing the decisions we are making as a department. Things like this networking event where we can come together, talk as communities with one another, share the best practices, share the things that have worked, share the things that we've tried, those lessons learned that, hey, we might have done it a little bit differently. So we can really, learn from one another, and within the state, getting state boards connected with one another, but then across state lines, and even across the nation. There's an opportunity here with this network, and we're really trying to capitalize on that and start, disseminating and sharing that information about the good work that you all are doing in your communities across the country. And ultimately, we're working to rebuild the trust of our customers and our communities. So I do understand we have some community partners that are not currently members of a community veteran engagement board. And so I just want to take a moment to kind of share a little bit more about the concept. If you take a look on the left-hand side of this slide that I've pulled up, this is really what we find out there in a lot of our communities. It's really an asynchronous effort there of a lot of good people working in support of the veteran, community. And what we're really trying to do with, helping facilitate CVEBs is really bring those people together, give them a seat at the table, have a collective voice, and really help our customer base navigate the system and systems within their local community. How can you get involved? Well, you can, definitely reach out to us, and our team will help you establish a CVEB if there's not one there already in your area. If there is, we can help get you put in contact with that local board so that you can potentially join that board. You work with your local community to brainstorm local solutions. One of the things we like to hear about coming out of the community veteran engagement boards is as they take the information that they learn back into their organizations and their organizational channels throughout the community, they're able to share their stories, share the experiences, get the word out, and that really helps everybody move. Fostering community-based partnership and creating a common agenda for veterans to focus on. Website and contact information is on this slide. We'll make sure that the slides get out to you, but we have toolkits there, information to help you set up a board if that's what you're trying to do. And of course, our team in community engagement will walk you through each step of that process. Quickly, this is our footprint right now. Here's an update. Dr. Davis and Jim both shared we had 142 boards in the network. As of yesterday, we have a new board coming online up in Wisconsin. So thank you, Gil Stubbs and Carmen Gamble, who are up there and working with that board this week. So they will be entering that into our network this week. So we're up to 143 boards. So again, like I said, exciting times. Communities are excited about this, and as this continues to grow, you can see the opportunity here, of the impact that we're making and the opportunities to work together. Again, the website located at the bottom of that slide. And last, just want to say this is somewhat of a call to action. So if you know of existing groups that are out there, or you are one of those community partners that's thinking about starting up a CVEB in your local community, you've reviewed the toolkits, but by all means, reach out to, I've got Jim Worski's email address. You've got my email address. You've got Andy Martinez, who is our program manager. You can reach out to any one of us individually. We've got a contact mailbox, vetfriendlycommunities@va.gov, and we have local representatives, like I said, in each of your areas. So what we'll do is we will get you any information you need and facilitate that introduction to that point of contact that can work with you and your community directly. So with that, I'll turn it back over to you, Veronica. Thank you.
Hey, Chris, this is Jim Worski. Just wanted to thank you personally on a great job you did on talking about the VEO story and of course, highlighting our CE, community engagement team and the successes. And much appreciate the work that you're doing and putting that together, calling in from Arizona. Veronica, as Chris had mentioned, we'll give it back to you to MC us through for the remainder of this networking event. But thanks, Chris, and thanks, everyone. And I hope everyone has a great opportunity to listen to and give their experience and have any questions answered. So, Veronica, back with you. Thank you.